Hello ladies and gentlemen, we have a first high-yield pharmacology question. We have a 58-year-old woman with type 2 diabetes and obesity. She started on a medication that improves glycemic control and promotes weight loss. 3 months later, she reports dysuria, which means painful urination, as well as recurrent genital infections. Which drug class is most likely responsible? So we have an old, fat, diabetic woman who got prescribed a medication for her glycemic control, which means to decrease her blood glucose levels, prevent them from getting excessively high. And she's now complaining about recurrent genital infections. We have 5 options here. A refers to the sulfonylureas, B, SGLT2 inhibitors, DDP4 inhibitors, thiazolidinediones, as well as biguanides. You need to know that all of these classes of drugs are actually used in the type 2 diabetes mellitus management. All of them basically function to either increase the endogenous insulin production or to decrease glucose in the blood by other various types of mechanisms. But specifically in this case, our correct answer choice is B, SGLT2 inhibitors. So drugs such as canagliflozin, dapagliflozin, basically the gliflozin ending compounds. So how do they work? These molecules work by inhibiting this SGLT2 cotransporter, which reabsorbs glucose as well as the sodium from the tubular lumen. And this transporter is located in the PCT of the kidneys, where we have basically 100% of the glucose reabsorption. If we block this reabsorption, glucose as well as the sodium, which would go together, now have to stay inside of the lumen. And this will give us a clinical sign of glycosuria, presence of the glucose in the urine, which we see in disease processes such as in diabetes, or we can see in the usage of the drugs which actually inhibit the reabsorption of the glucose. These drugs are good as far as the weight loss, because if we're not reabsorbing these macromolecules into our blood, these will be directly lost calories. However, while being good in the sense of weight loss, they also promote a very nutritious microenvironment for different types of pathogens, especially the bacterial and fungal infections, which can cause disease in the genitourinary tract, and most commonly we see them by fungal candida species. And that's it for this question. I hope this helps. Follow ConceptRx.